It's 1:31 p.m. and what else would we want to be doing on a finally dry afternoon here at Chapel Hill than sitting in a fluorescent room hearing slides from us? Oh, you'd rather be here? Me too, and I appreciate all of you for your attention. We will keep it fun. So the title, I hope you're in the right place. If you wanted to hear development of a hygiene insecurity experiences scale development, implementation, refinement, and dissemination, that's what it is in the program. However, James Brown, in his infinite wisdom, suggested we call it Beyond Soap and Water, developing a global measure of hygiene insecurity experiences. So James, this title slide is for you. And we have like a Loteria theme, given that it's almost Day of the Dead and we have so much data from Mexico. But it's also a nod to Bangladesh, where we will also be, or you will also be, hearing data and stories from. So before we continue, I just want to appreciate that this is the work of many. You'll hear from a handful of us. But this is hard work from many who are in the crew. And it's also not free to do this work. So we are super grateful to RGHI, who are our primary funders for this work. We have also intellectual inputs from many of whom are visible here. Some are not so visible, but they're also here. This is a big exercise, and it's the work of many hands, so we're lucky. I'm going to give you like a 3-minute kind of background of how we got to making this scale. So I think many of you who know me know that I care deeply about understanding people's experiences with important resources. And I am a bit of a wolf in sheep's clothes because my training is not in water. It's in anthropology and nutrition. My PhD is in international nutrition from Cornell. In the first 10 years of my career, I thought a lot about food security, breastfeeding, pica, fun fact. But it was on this trip, and I know, in fact, 12 years ago, because Aurora is now 12, I kind of had a revelation, and the next phase of my career moved towards water. So any of you who've heard me talk about water insecurity stuff probably saw me talk about this picture, which is this woman. She has on-access premise. This is in Kenya. She has on-premise access, and there's physical availability of water as well. But you'll recall the way the story goes is that her mother-in-law was not letting her use the water that was on-premise. So she had to go to great lengths to fetch water, causing great harm or premature labor to her, and eventually her infant was okay. But resources matter, and experiences with resources are kind of what really matter, what we're finding from a public health point of view. So the WISE scales have been fruitful, and thinking about water insecurity experiences have been fruitful. This is a map that's honestly already out of date, where the purple represents nationally representative data, the dots are site-specific data. They have really taken off, in part because they've been useful for a lot of different purposes. So we could reveal hidden water issues, we could estimate the prevalence both within and across countries because the data are comparable. We can monitor impact of different interventions or different shocks. We could, I like using this word, gateway drug. It's one thing to get people who care about water to care about measuring experiences with water. But we can tie these data to food security, to HIV viral loads, to economic prosperity, school attendance, exclusive breastfeeding. And they're good examples of these data being used to advocate for resources, etc. So the WISE scales have proven useful. And I kind of like having a baby. You don't realize what it's going to entail until you have one, and that's like scale development. It's hard. I always say blood, sweat, tears, and gray hair. That's true. And so I was like, yeah, wow, who knew that I would be studying water? And who knew that I would be making scales? But I haven't. Oh, yes, and all of this, the uses are summarized. And these bad boys, we have an impact report of the WISE stuff, and then we have a manual that can guide implementation, and this is available in a number of languages. So who knew I would be doing that? But I was like, phew, WISE scales, they're done. I can move on with other stuff. But then I have surprised myself to say there's more to WASH experiences than individual and household level water assessments. And I really, really blame this guy. So who knows John Brogan? I know John Brogan, he's at Helvetis. He said, hey, Sarah, I love your scales. This is like great. Have you thought about doing it for institutions? I was like, John, no, we're good. I don't know if you can see those big blue eyes, but those big blue eyes I couldn't say no to, and before I knew it, we were on a big mission to measure WASH in institutions, and WASH broadly. And this is in schools, healthcare facilities, and eventually prisons. And like, huge shout out to Professor Josh Miller up here, who is co-leading these efforts with John Brogan and Christina Barstow. But so we have this other WISE flavor of WASH in institutions. Apparently you can't give a talk at this conference this year without a QR code, so QR code, there you go. If you want to be involved in measuring WASH in institutions, all the cool kids are. I highly recommend you join the party, and you can talk to Josh or me or Christina or John about this. Okay, so John was tough, and I couldn't say no to him. But you're saying, like, this is not about institutions, this is not about household and individual water insecurity, Sarah. This is a session about hygiene experiences. And for that, I blame this beautiful person here, Danielle Latanya, who's at Tufts. Who knows Danielle? Be careful, because she has good ideas, and before you know it, she'll be getting you to do her bidding. So I super appreciate / blame Danielle and for really, encouraging us to measure hygiene experiences of both individuals and households. And on top of blaming Danielle, I also fault RGHI for funding us to do this work. And just so it can feel like a mess of scales, I just want to put into place for you what we're doing. We don't just do something and call it a scale. It's years and years of work, and I already told you the recipe of blood, sweat, tears, gray hair, so you're warned. But to put this together, what we're going to be talking about today is this quadrant here, hygiene. So we have established measurement of water. Ian Ross, I know some of you know Ian, has done a great job of measuring experiences of sanitation. And this is kind of the third pillar to the WASH at the household and individual level. So with that, I'm going to turn it over to this appreciated and despised, sorry Danielle, who has inspired basically all of what you're going to see today.
All right, Danielle, we are ready when you are.
Okay, can you hear me?
Yes.
Okay, fantastic. It's great to be here, and it's been fantastic to work with Sarah and her team on this and everyone involved. It's a really important project. And so I have been tasked to give a little bit of an introduction. And so about 5 slides giving a reason why we wanted to do this. So next slide, please. So why a hygiene insecurity experiences scale? I think at this conference, we can assume that everyone is very familiar with JMP and what we monitor and the ladders for monitoring drinking water, sanitation, and hygiene for 2030 agenda. It's super important that now, as part of the JMP, hand washing is now reported at the national and subnational scale with standard indicators to look at basic, limited, and no facility hand washing, and plans to include more indicators within this kind of hand washing arm and expanding it to hygiene in the JMP. I think a lot of us probably remember a time when there wasn't even a hand washing or hygiene section of the JMP, and it's been amazing to have it. And we in no way want to say that this is not important, because having this kind of data across the entire world with the same indicators is incredibly important. While it's important, JMP doesn't include kind of individual experiences of insecurity or, at this point in time, hygiene beyond hand washing. And so next slide. And so there's a gap that can be filled with these experiential scales. They can complement this national level survey data with individual experiences. As Sarah talked about, there's a number of scales right now. HWISE is one example, and measuring these experiences of interruption or clothes or plans or drinking or body and how people feel about insecurity. But there's also a number of other scales existing right now across the sector. And there is a need for a hygiene scale, which is why when people talked about it with RGHI and myself, and they said, reach out to Sarah, and then Sarah reached out to everyone, and this great partnership was born. Next slide, please. So one of the first things we did, and James Brown took the lead on this, was a narrative review to establish a framework of what actually hygiene is. And so within that, James and us all and the technical advisory group came together and kind of came up with 4 kind of large frameworks for how hygiene is considered. And one of that is operational, the infrastructure for hygiene, hygiene promotion, the theory of change, the logic for hygiene. I think we often talk about that in programming or grant reporting. One of it is a biomedical framework, talking about barriers to behavior, compliance, this idea of like, you should hand wash, why don't you? And then health outcomes, really focusing on the health side of things in reduction of disease, particularly diarrheal and respiratory diseases. And then also those feed into social cultural frameworks around norms and stigma and gendered roles and kind of moral dimensions around hygiene, and then also psychological dimensions around emotion, identity, order, kind of self advocacy and efficacy to do your own hygiene. And when you look at the literature, you can kind of divide, and you can imagine reading a manuscript or a report and seeing where of these frameworks this fits into. Next slide, please. And when we kind of put all of this together in the narrative review, a framework for how we wanted to think about this is hygiene's not a singular or static concept. It encompasses all of these things: infrastructure, materials, behaviors, meanings, motivations, and it's shaped by health, culture, emotion, and identity. And there are operational and biomedical dimensions which have historically dominated the literature, but a complete understanding must include also these psychological and symbolic dimensions. And most studies that exist historically have kind of relied on these pragmatic or programmatic definitions, but some studies have really worked to illustrate the definitions of hygiene in context. And so the goal of this hygiene and security experiences scale is to first define, which is a hard task in and of itself, and then figure out how to measure hygiene in context. And so next slide, please. So when we talk about measuring hygiene, kind of in the narrative review, we came up with a list of ways people have done this. And we're probably familiar at the conference, people will have presented this: spot checks, observing conditions, soap, water, clean hands, structured observations, which are considered the gold standard, self-reported measures, did you wash your hands, when do you wash your hands, physical sampling, such as the level of contamination, bacteria, residue, etc., novel approaches using mobile apps or video monitoring, and then mixed methods designs. But when you look at this, this is all thinking about it from a biomedical perspective, from an operational perspective, and not thinking about the experience that a person has. And so the goal of what we want to present today is to get at some ways to measure actual insecurity and experience of hygiene. And so next slide.
Super, thank you, Danielle. We are gonna pause for questions. Does anyone have questions based on Danielle's presentation? Okay. We will also have a Q&A at the end, so if you have questions you want to ask them later, we'll hold them for then. Thanks again, Danielle.
Thank you, everybody.
Yep.
Great. Danielle, I wish you could see all the smiling faces here. Lots of enthused people. Hi, everyone. Josh Miller, a newly minted professor at University at Buffalo, sitting in a Center for Climate Change and Health Equity. Everything I've been on, I have to make a plug. There's the department, it has 7 postdoc positions, so if there's anybody who's looking for something in WASH, global health, HIV research, all the things, there's probably a position available for you there, so consider it. I am going to present on some of the key milestones we've had so far in this project, and I am unable to advance.
I have to click back on that screen.
This one over here.
Yeah.
Ooh. Okay, so we've been talking a lot about like scales and measurement, and just so we're all kind of on the same picture of what these terms mean. I first wanted to just define an indicator. This is probably not shocking to a lot of people, but a indicator is something that is typically just measuring the presence, absence, or a level of something. So to put that into context, or how an example that a lot of us have come across is that's what mostly we use to track the SDGs, is we're trying to track some sort of indicator of whether we're meeting a certain threshold or not. And for that, for hygiene, it's going to be looking at the level of facility, so whether there's any sort of facility, and then if there is a facility, does it have soap and water? And so then we can track and compare this across sites and say X percentage of people do or do not have this service. A scale is related, but a little bit different in that what we're trying to measure is a latent construct, which is just kind of a fancy way of saying something that we think exists, but I can't take a thermometer and go and measure something like depression. There's no scale, I can't see it, I can't observe it directly. But we think that there's a set of items or something underlying it, so we think that depression may manifest by, it could influence being bothered by things, having a poor appetite, feeling lonely. So we can measure these things, we can ask people about those as a way to try to get at this latent construct. And so that's what we're trying to do here, and as Sarah mentioned, the process of scale development can be long and arduous, but it is well defined, and we are following the playbook for how to do it well. And that starts with defining the concept. What do we mean when we say hygiene? And Danielle did a really good job of talking about hygiene's a lot more than hand washing, and that's typically what first and foremost we measure, but there's also aspects of domestic cleanliness. What is, are surfaces clean? Are people worried about animal feces around their households? Food safety and food preparation, sanitation, and like the cleanliness of toilet facilities, menstrual hygiene and management, and also imbued into this is sociocultural norms, and we do certain hygienic practices because we are trying to also meet certain types of moral norms. For instance, maybe more likely to wash your hands at this conference because it's a WASH conference, and there's all these people around you. So provisional definition of hygiene and security that we've come up with, this has been our operational definition to go through more iterations, but what we are considering hygiene and security is a condition in which individuals are unable to reliably access and use adequate facilities, services, and supplies to maintain cleanliness for dignity and well-being. The word dignity is doing a lot in this, in terms of both people meeting what they want as their own personal level of cleanliness, but also meeting certain norms that they feel like they may have to meet, even if they don't feel morally obligated to always clean in certain situations. So I turn it to you, just briefly. I'd love to hear and make this a little interactive of what would you ask to measure hygiene and security? Any questions, anything? What would you like to know from people? People?
Do you feel clean?
Okay. Love that. Simple, easy. We ask that, like, yeah, when we measure depression, if you feel depressed.
What makes you feel clean?
Ooh, okay. I'm liking these. I'm like, ooh, we need to reconsider our questions. Well, to give you a sample of the types of questions we did land on, from just some of these domains were personal cleanliness. So these all take the form of, in the past week, how often did you X, Y, or Z? In the past week, how often were you unable to get your hands as clean as you wanted to while at home? The domestic cleanliness items about feeling worried by animal feces in or near your home. Food safety, just asking people if they ate food that they thought was not prepared safely. And some of these things that try to get at this interpersonal relationships that people have of how often did you feel uncomfortable around others because you were unable to clean yourself the way that you wanted. So this is some of the items that we came up with in August, October of 2024. Then got feedback. This is maybe the worst photo ever taken, but it's now been in this slide deck twice. We have a technical advisory group of 11 folks who are really lovely and a core team of about 9 of us. So there's like 20 folks who put their heads together and thought, how are these items? What do they mean? So sent around a Qualtrics survey to everybody on the team and asked them to rate the relevance, clarity, and comprehensiveness of the items. You're also maybe wondering why we used a 1-week recall period, and that was also asked as expert opinion of what would be a reasonable recall period. And we want a recall period so that you can measure this at multiple times and know that it was a certain period, as opposed to something like more amorphous of like, do you generally feel clean, or something, so that it's a little bit more time bound. So this is what it looked like of asking people, is this a relevant question to be asking? Is it critical? Somewhere in between there, and then how would you edit it if you could? So we had 49 candidate items. That's way, way, way too long. And we got rid of 18 of those for various reasons. That they either weren't, 75% of the advisory group didn't affirm it as being relevant. Some of them were just redundant. Some were flagged as not being universal. That's key to what we're trying to do is we've piloted it in 2 sites, but as you'll hear, we want this to be truly cross-culturally valid and relevant, and you can measure it in one setting and generate a comparable score in another. So some of those experiences just weren't going to be answerable to certain populations, and other things that we were like, that's not hygiene, why'd you put that in there? So down to 31 items. The second phase of scale development is actually going out and implementing it and getting out of our ivory tower and going and asking people do they think of the items, how is it fitting, what's the response patterns, what are they telling us? I just said that, and yet here's more of us at ivory tower. At UNC last year, we schemed up an idea of how we would actually go about in designing a sampling protocol. So exciting that has now been put into place. And this is us in Mexico City also of getting to talk about, and yeah. So what you'll hear about is what ended up getting tested in Bangladesh was 31 items. There was also 31 items tested in Mexico. They will show later, there were some slight variations and changes between those, so even though the number is the same, they're actually slightly different. In phase 3, you'll hear about later, and that's where we actually test and see, are these items hanging together in a way that's meaningful and measures something relevant. Okay?
Questions for you?
Oh, do you have any questions for me?
What's your favorite phase of scale development?
Cognitive interviewing is always fun because that's like actually where people get to report how they think of items, and then I love stats, so it's really nice to do the like confirmatory factor analysis. Thank you so much for asking.
You mentioned how you try to find more like universal factors. Did you ever try to find culturally specific factors?
So yeah, this came up in a lot of, actually, this will come up in a moment, I guess, with other people talking about some of these site-specific questions. And this is a thing with just the Y scales in general of always encourage asking the universal set and then complementing those with other things that might be really highly culturally relevant, so you can at least have that comparable score and we can all say, okay, we understand this to be hygiene and security, but you know, in this setting it might be, for instance, it was coming up of like hair washing is like really important in some places, or beard maintenance and being able to shave, and those weren't going to be universal questions, but in certain contexts could be really good. So that's like the flavor of things that got screened out, but yes, good question. Okay.
Okay. Hi everyone. My name is Liz Thomas, and I'm at the Johns Hopkins Bloomberg School of Public Health, and I am going to talk about round 0, where we pilot tested those 31 items in rural Mymensingh, Bangladesh. And we did round 0 in the context of a poultry housing and feces management intervention that I am currently collaborating with in partnership with icddr, which is colloquially known as the Cholera Hospital, and it has a very long-standing relationship with communities and implementing water sanitation and hygiene projects throughout Bangladesh and within the communities that we work with in Mymensingh. And I mention that because it is very common for icddr to come and ask questions about water, sanitation, and hygiene. So when we piloted these items, there was an understanding that we were likely going to be asking about water, sanitation, and hygiene. We were interested in exploring impacts of our poultry management intervention on perceptions of household hygiene because it was a major motivator for building improved poultry housing, was improving cleanliness of the inside of the home. And that is how I got linked up with the lovely crew who's working on developing a household level hygiene and security experiences scale. And this is the site where we did round 0, just for context again. You see here there's a household courtyard. This is pretty standard in rural Bangladesh, and the inside of homes is typically would be looking like something that you see here on the right. It's common to have earthen floors, and what we were able to do is go into homes that we were partnering with and do cognitive interviews with both men and women and field test the items with women who would be our target population, and then pilot test the items throughout our intervention communities, again with women only. I mentioned that this was a poultry intervention, and in this context, poultry raisers are predominantly women, so that was our population of focus. Today, I'm going to present on Josh's favorite part of scale development, which is the cognitive interview findings from Bangladesh. So you'll notice that some of our items are framed around how often you experienced a situation of uncleanliness. And there was a question about why are we asking about cleanliness and uncleanliness in our tag group. And so one of the things that we wanted to do in our cognitive interviews was explore whether or not the concept of uncleanliness and cleanliness was translating as we wanted it to. And so we asked participants what the word cleanliness meant to them, and we asked this about cleanliness itself, cleanliness inside the home, and cleanliness in the courtyard. And what we found is that responses varied quite a bit dependent on whether or not we were asking about the self, house, or courtyard. So when we were asking about the self, participants talked about bathing and clothing and hand washing as well as prayer ritual. When we were talking about the house, floors, furniture, smells in the home, and then the concept of order or tidiness came up. And then in the courtyard, cleanliness surrounded waste disposal, animal waste, debris that was present. You saw in the previous slide there were leaves in the courtyard. That came up a lot. And so we thought that we were getting at what we wanted to with these questions based on these responses, because they were mapping on nicely to the concepts that Danielle mentioned earlier, biomedical, the biomedical realm, the operational realm, and the psychological realm of hygiene. However, one of the questions that came up in our tag group was, why are we asking questions framed around uncleanliness instead of dirtiness? Which one are we more interested in? Which one gets at the concept better? And so we asked our participants this question as well, what the difference was between unclean and dirty, and would they like the questions framed in one way or another. And at least in the context of Bangladesh, the term uncleanliness was preferred over the term dirtiness. And here are a couple examples where participants felt like the word dirty or dirtiness didn't sound good to them. It made them feel a little offended about what we were asking. Dirty meant rotten, not good. It just didn't sound very good to be asking questions about that. So at least in the context of Bangladesh, we retained the wording of items around uncleanliness. It was also what we found to be the closest terminology to the concept of hygiene. We also explored with participants during cognitive interviews that same question that we had asked tag participants about what was the recall period that worked the best. Did it work to ask about a 4-week experience or a 1-week experience? And what we found is that participants said, oh, you could ask either, it's fine, I can answer and tell you about what I experienced in the last month or experienced in the last week. However, during cognitive interviews, all of the explanations that we were getting for the responses were about what happened in the last week. So this matched what the tag had suggested, and we stuck with the 1-week recall period. We also asked participants about their understanding of the different response options we had. So how often in the last week had you experienced X? And then here were the original response options. And while we found that most participants did understand and could respond with these response options, we found that it was a lot easier for participants to respond, and they preferred to respond in the number of days that they had had that experience in the last week. So even though some participants would respond and say never, and then they would follow up and say 0 days, a lot of participants would just say 0 days. So we stuck with asking the question in terms of the number of days. We also piloted a visual analog scale where we were asking participants to indicate how often they had had this experience based on the scale, which had a percent of, from 0 to 10% of time that you had experienced something. And while some participants could respond using this approach, it wasn't preferred. And we also had a lot of variation about what 50% meant. Did that mean 2 days? Did it mean 4 days? Did 80% mean 4 days, or did it mean 6 days? And so again, we decided that it was better to stick with the number of days as the response option. And then the next thing you'll notice is that quite a few of our items had the phrasing about asking whether or not participants were upset, bothered, or worried. And what we found is when we asked these questions in cognitive interviews, some explanations to the items were about feelings. Some explanations to questions about feelings included feeling words and explanations, like saying, well, sometimes this happens and it worries me. And then sometimes the explanations to questions about feelings focused more on objective experiences. Like, well, that didn't happen to me because I shower 3 times a week. And so it made us at least reflect as a group about which questions did we want to ask and get a sense about the feeling about the experience, and which questions did we want to ask to actually explore the experience itself. So in terms of specific items, here are a few examples of what we learned from round 0. One thing is that some terms were really clear to participants in Bangladesh, whereas others needed to be clarified. So in Bangladesh, questions about the plot as a space were very clear. There were very clear delineations of space. The courtyard and the surrounding area was understood universally as what was meant when we asked about the plot. However, when we asked about household waste, we had to rephrase this and clarify that we were asking about garbage and trash, because the term for waste was not well understood by our cognitive interview participants. We also wanted to make sure that questions that we were broadly asking about food hygiene, for example, were being understood to be asked about food hygiene. And at least in our context, we did find that that was the case. So here's an example where we asked in the past week, how often were you worried about the foods you ate at home not being safely prepared? And the respondent clearly responds never, and mentions food hygiene practices that are practiced in the home, and therefore she is not worried. We also found that, at least in the context of Bangladesh, our initial item that asked about pests in the home, all responses were about mosquitoes. So we initially asked in the past week, how often were you upset or bothered by pests like flies, cockroaches, or rodents in or near your home? And even though we specified those pests, we saw that participants were answering about mosquitoes in or near their home. And so what we did is we split it into 2 separate items, one that specifically asked about mosquitoes, and then one that specifically asked about other pests. And we're glad that we did this. If you were at the plenary yesterday, you know that mosquitoes are linked to hygiene, and so we wanted to retain that item. But also by asking the items separately, we were able to get at experiences that were common in our study setting with certain rodents that were very linked to negative hygiene experiences. We also found that we had initially several questions that asked about coping strategies. So we asked specifically about borrowing water, soap, and other supplies to clean home, to clean hands, body, or hair, and then to wash clothes, and that was very redundant in our setting. And so what we did, at least for Bangladesh, is merge it into one question where we asked about borrowing these items for any purpose. We also found that in a lot of the cognitive interview explanations for for poor hygiene experiences in the last week, recent illness was mentioned. So here we see that one participant is explaining as a response to the item in the past week, how often were your clothes not as clean as you wanted? She responds, sometimes. Due to the household work, stress, illness, she couldn't keep her clothes as clean as she wanted to. And we did have some limitations on our ability to explore some of the items that had been drafted. So some of our candidate items were menstrual hygiene questions as well as personal cleanliness questions around private parts. And because our population was entirely female and our enumerators were male, the participants and the enumerators were not comfortable asking these questions, and those questions were not asked in Bangladesh. The main takeaways from round 0 that were combined with those from Mexico, which you'll hear about soon, were that most items were clear, some revision was needed, but participants were generally very willing to respond and provide explanations about potentially sensitive topics. It also seemed like in our context, in rural Bangladesh, items were well understood to be about hygiene, and it did lend some very helpful reflection on the part of our group about which items needed to be about feelings about hygiene insecurity situations, and then which should be about the experience of a hygiene insecurity situation itself. Lots of acknowledgements here to our group at icddr, who led the data collection, as well as to especially Ridwan Mustafa Shialbai, who could not be here today because of visa issues. But a very special thanks to all of these individuals who drove this work, as well as the funder, both for the hygiene project and the poultry project, which is RGHI. Okay, I'll pause there for questions.
I just had a clarifying question. When you were showing what the interviewer said and the respondent said, the respondent replies were like, she said that due to illness and stuff,
Yes, I'm sorry. I have them written as field note form, so they're written as field notes rather than as transcripts.
Oh, but it was the respondent who was saying,
Yes, I have this, and then we would write it as she said X.
Gotcha. Thank you.
Yeah, thanks for that. Yep.
Sumaya Kazim from NC State University. So my question is, did you check any weather variable and whether the seasons have any effect on how they respond to these questions? Because this is my study area as well. And I work with these same people from icddr, so
Okay.
we have seen some weather variables as to like how EQUIDE numbers that vary from season to season. So
Yeah, that's a great question. Definitely in cognitive interview responses, we saw that. So especially around the time that we were asking the question around pests, it was in the lead up to when mosquitoes were very prevalent. So that's also potentially why some of the responses were immediately about mosquitoes. We also saw when we were exploring those, the differences between cleanliness of self inside the home and courtyard. Recent rainfall came up a lot, so whether or not that would create mud and other smells, or needing to not being able to go outside because the paths were too muddy or dirty or filled with animal feces because animals were closer to home, that did come up a lot during those interviews. Yeah. Yeah, Niku.
Hey, so this is Noor from this institute, icddr. So my question is about the feelings during the humidity issues, and like when you talk about hygiene, look, although the environment is clean, but if the humidity is really extreme at night, or if the ventilation is not there, he or she not feel well and they will go for bathing or like cooking. So how you will integrate this with this model, like how you find this type of things?
Yeah, that's a really good question. I would imagine that some of that might come up when we are doing additional rounds of piloting, which we are hoping to do soon and looking for people to do. Checking to see whether or not some of the responses around cleanliness of clothes, cleanliness of body change around weather patterns.
And just additional to this, about the settings, like, rural settings are less condensed, less people are there. But if you want to replicate this in like urban areas where there is like a huge pollution, particularly dust pollution in urban areas is really acute, and very people are really densely actually attached with each other. So how this will actually integrate with them, and there, I believe there will be a link between this densely populated versus humidity, and also like these structural issues of the housing, so that can be introduced.
Yeah, those are all really good points, and you are going to hear soon about how some of these items did in an urban context. I also think that it's important to keep in mind the other data that need to be collected alongside these, such as spot check indicators, to help us get a better sense of how these items are doing dependent on different infrastructure situations, for sure.
This question is for Nuhu. Are you thinking about possibly wanting to help try this out in some spots?
For urban?
Yeah.
Yeah, so in urban areas there are lots of confounder or like effect modifier would be, particularly transport if you consider transport. It depends on different transport and different type of issues with the hygiene. And at the same time, housing condition is another way. That people bathe, and I have report that people bathe 3 or 4 times because of very warm or unhygienic like air. So yeah, I think since this is something we are developing about indicators of hygiene, considering the humidity and climate changing rapidly globally, that could be one things we can focus on.
So that's a maybe.
I agree. Yeah, I agree with you.
I think what you're saying really does matter, though. One of the things that we have found is that context does matter, and as Sarah said earlier, some of these items, or Josh said earlier in response to the question about different contexts, some of the items would need to be tailored based on context, and I think that's a really helpful point to keep in mind for us thinking about what kind of pilot sites we need to recruit in the future, including urban TACA.
Yeah, happy to discuss further, but rural, I think is easy to manage a lot of way, but definitely facilities are lack, like hand washing facilities, like one of the biggest challenges with like solid waste management, or like management of poultry or cattle waste. So they don't know how to, they just dump it. So, but urban is totally different, is a different era of things that needs to be considered separately actually. Yeah.
I think that's a great segue into our next presentation, where we will hear more about learnings from an urban context.
Yeah.
Thanks for those questions.
That is correct.
Hi everyone, I'm Lucia Felix Beltran. I am a researcher at the Research Center for Equitable Development, or EQUIDE, in Universidad Iberoamericana in Mexico City. And I led the data collection efforts, or round one, specifically for the development of the scale. Very urban. So getting to that, we had 3 different data sources. We also did cognitive interviews in June. We did the full survey in July. When I say full survey, it's because it's going to include the hygiene experiences, hygiene and security experiences scale items, and other validation modules that we also included to account for confounding and associations. And we just finished a revisit to 80 households from the first round. So I don't have any data on that, but that's done. So we are done with data collection. So the cognitive interviews. We didn't do the cognitive interviews at the sites where we actually collected the data, but I want to tell you a little bit about the place where we did do them. The university has a community center that caters the population. It's located, if anyone knows about Mexico City, there's a place called Santa Fe, and it's highly unequal, as you can see in that picture. Those buildings are corporate headquarters for transnational corporations, and right next to them you have really, really dense population living there in not necessarily like high poverty, but it's a different sort of setting, and the community center caters that population. So we did the cognitive interviews with individuals from that area. We did 15 in the community center, and we reached saturation really quickly because it's people that go either to workshops or classes. So we did 5 elsewhere, just to get a sense of, we were trying to test if the items were understandable, if we were getting to what we thought we were getting to. So some of the difference and similarities between the cognitive interviews in Mexico and Bangladesh is that, just as in Bangladesh, in Mexico the term waste was unclear, so we also translated it into garbage. We just directly used the word garbage when we were asked about waste. The question reads something like, are you able to dispose of garbage in the way that you would like to in the past week? And we also use garbage. We also identified a difficulty linking to feeling and emotion that emanated from their experience as opposed to the actual fact. And how we went about that was with visual aid for the data collection, but something I want to mention is that different than in Bangladesh, this population is not used, it's general population, so they're not used to having WASH questions being asked to them constantly. So we were asking them about hygiene practices and health practices, and they were like intrigued by why we were asking them about their ability to clean their private parts, you know, and to wash their hair, and do you care about how often you wash your hair and things like that. So it's a very different population, and they would immediately feel judged and evaluated. It was like an immediate reaction. So one way to go about that was that we used a visual aid for the actual data collection. Some differences were language related. So the items were originally in English. The translation for plot does not work in an urban setting. As you saw, it's highly population dense. So we translated it to around your home, whatever that is. If you're in an apartment, that includes the hallway. If you're in a house, that might include the street. So it's around the home. Uncleanliness was also unclear, and this might be a cultural thing. At least the population that we spoke to was really clear. It's like, oh, you're asking me if it's dirty. Okay, then it's dirty. Or you're asking me if I am unhygienic. Hygiene in Spanish is commonly used, at least in Mexico. It's not as ethereal and abstract as it is a social construct, but it's a word. So we actually ended up including it in our items. Different than in Bangladesh, animal feces were understood for pets. There's no cattle, poultry in the city, for the most part. And then this one's really interesting. Food safety, the concept of food safety, we're not getting to it. Like there's something there culturally, linguistically, that we need to refine, because safely prepared foods were understood as healthy foods. Or you're asking me if I eat quality food. No, that's not what I was asking, but good to know that that's what's being understood. Finally, for coping strategies, when we asked them if they had to borrow water, soap, or cleaning materials, basically people would tell us, well, I have water. That's what matters. Everything else is not, it didn't sound like an issue. The issue is water. This is the visual aid that we used. It's in Spanish, but what we wanted them to hold on to was the feeling, because when it's factual, the question is clearer, but in order for them to not feel evaluated, we gave them a visual aid. Like numerators had this visual aid, and we would ask people to point to the frequency with which they had experienced the sentence that has been read. This is the full structure of the survey. We have a household census, we have socioeconomic status, we have the hygiene and security experiences scale that included between 31 and 36 items. Those additional 5 are for menstrual hygiene, which were only done by enumerators that were women, for women. Household water conditions using JMP. We used water insecurity scale. We also have household sanitation conditions, sanitation experiences. We have a health module that includes mental health, gastrointestinal disease conditions as well, and some household conditions. So, this took place in Mexico City. It is a large city with a lot of people. Officially, 9 million people live in the city, but if you take into consideration the larger Mexico City, the metropolitan area, that's 22 million people. So it's like dense, like these aspects that you mentioned about urban present here, not necessarily with the humidity, but housing, like all of that comes up. So high population density, very urban place. So instead of only doing, we aimed for 1,000 households, and instead of doing 1,000 random households, we targeted the sampling to specific places in order to maximize heterogeneity within the city. That meant that we selected 4 different site types. I'm going to be using this terminology in the rest of the presentation, but using publicly available data about public infrastructure, poverty, and scheduled water distribution. Those were criteria we were interested in. We generated these site types, and that's where we went. So type A is like the best off under these criteria. It has high infrastructure, very low poverty, and not scheduled water distribution. Scheduled water distribution means that so in Mexico, in Mexico City, since we have water issues, there's a program that's called Tandeo, and the government publishes a list of neighborhoods that will have to go and get water like twice a week to a tanker truck, because even though they have infrastructure, they might not have available water at all times. B is high infrastructure, medium poverty, and they have scheduled water distribution. C is low infrastructure, medium poverty, and scheduled water distribution. And D is low infrastructure, high poverty, and they don't have scheduled water distribution. I do not expect you to remember this, but I just want us to keep in mind that there was variation, intentional variation in the places that we went to test this.
Just one clarifying question. So is it good to have scheduled water distribution because you know the government is taking care, or it's not good if it's not there?
It's not good because it means, well, in the case of C, for example, you have the infrastructure, like you have pipe water, but you don't have water running. So it
Gotcha.
speaks
Yep.
to like a lack of capacity. And in the case of D, I mean, it's what's available because they don't even have the infrastructure for the most part.
And these categories from the government or from the study?
From the government. All of this is publicly available information. We did this at the census tract level, and then we went to households. And there was another sampling strategy for households that I'm not going to go into detail with, but after we selected the places we went to, this is why I wanted to show you the differences. And we have a little bit over 250 in each site type. But as you can see, they look very different. So for example, this type C I mentioned, it has an asterisk. People in these households have to walk up these stairs and go get the water from a tanker truck, sometimes twice a week, sometimes once a week. Whereas D is more vulnerable in infrastructure conditions, but the landscape is not as harsh, right? At least for this study. Where we went. Going back to the urbanicity situation, gaining trust in an urban setting when you're not the government, you're not a public agency, we're a university, people would not, there's a lack of trust. So we had this beautiful flyer where we would invite people to participate, and they could totally say no, and then they could keep the flyer with all the information. So getting to some of our results, in blue, like the first 3 bars, the blue, the gray, and the orange are JMP indicators. So we can see that there's practically universal access to improved water infrastructure per JMP indicators, either to drinking water, sanitation facility, or water for other purposes. But once we get to water insecurity, which in this case is water security, we do start to see a gradient. Like there's less water security as you move from A to D. And all of them, something that, again, as I mentioned, this is a historical issue in the city, all of the household types reported water interruptions. They were scheduled, but they all reported them. And as I mentioned, there seems to be a gradient in water indicators with respect to site vulnerability, right? Like what I meant earlier. The same goes for hand washing infrastructure. So I broke this down, but what I want to get at is that there is water, there is soap, and there is a primary head washing facility that's, I think it's basic, right, by JMP standards, across all sites. So just to keep that in mind, it's not, the resources are there, but we'll see what happens with the hygiene experience. So going into the hygiene insecurity experience items, I wanted to show that we have affirmative responses for all of the items. This is interesting, I thought. Most of the, like the highest rate of affirmative responses, meaning that they were not never, is for domestic cleanliness. Like domestic cleanliness is a domain that had a lot of variation and also affirmation. And then the rest of the domains start to kind of intertwine and they're not as clear. Worried about uncleanliness of clothes, worried about uncleanliness of body, insufficient materials to clean home. These are some of the items. And what I mentioned about food safety earlier as well, it ranked last in affirmative responses. That might be a translation issue, like a cultural issue. It's something that's why we need more data on this. And to summarize that, like the highest share of affirmative responses was for the domestic cleanliness domain, and the lowest one was for food safety. So despite having universal water infrastructure access and high water insecurity, a relevant share of households reported always being worried in the past week about cleanliness of hands, body, and clothes. To your question earlier, do you feel clean? It's not that directly, I mean, it's not that question, but this share of households reported always being worried about the uncleanliness of their hands, despite that we do see that they have a facility, they have water, they have soap, or of their clothes, of their body. And something I want to show about these responses as well is that we don't see the gradient anymore across sites. So in theory, site type D is more vulnerable in infrastructure terms and material terms, but they are less worried about the uncleanliness of their hands than a site that is better off. You know, so there's other dynamics playing there. So we are with these questions, we are getting to other aspects of you know, behavior and motivations that are not just material. Some items were revised in Bangladesh and Mexico, and they're not directly comparable, in case you're wondering why we're not comparing. In the past week, this one was dropped. It wasn't applied in Mexico after discussions, and the other way around. This one, in the past week, how often did you feel your house was too dirty to have visitors? That one we did run in Mexico, but not in Bangladesh. So that's why we're not comparing directly. So implementation challenges in an urban setting. Some of them are gender-natured questions, like asking about menstruation and ability to wash private parts. Menstrual hygiene, as we mentioned, we did include it initially, but we stumbled upon some, like how to identify the population, who should be responding to these questions. Restricted access to homes for observations and spot checks, which are often used in hygiene assessments. Numerators did not go into households for their own safety and the population's safety. There's distrust. They had to negotiate in certain neighborhoods. They're collected at the doorstep, as you can see in the picture, but we used an observational checklist during retest to kind of get another data source on observation. And seasonality came up. This is the year, I think, the dams are full in Mexico City for the first time in like a decade. So we might be capturing something related to climate that's not necessarily constant. Quick lessons, we have currently 31 items that we tested. The results are robust for this round one. We need more data from additional sites because of all of these concerns about universality, like is this site specific? One huge recommendation, if anyone around here is interested, is language pre-testing is really, really important. And we can facilitate all of this with our upcoming field manual as we grow this in other places. And these are the people I want to acknowledge. My colleagues Pablo Gaetan and Jimena Ruiz, the data collection team, and the community center. Yes.
Okay, so my first initial impression is comparing Bangladesh and Mexico may be catastrophic, because when you see Hollywood movie for person with the Mexican people and Hollywood movie person with Indian subcontinent people, the behavior are totally different. Activities are totally different. Similarly, I think for these indicators, that will never match, number one, from my side. Number two, when you are talking about the understanding of the questionnaire by the respondent, certain indicators like food hygiene, water, or like hygiene, garbage issues. So what we do in Bangladesh, first of all, pre-test and try to understand ourselves with the local people, that whether they understand or not. For this case, didn't you actually perform that type of exercise to then why it is happened like at the data collection time?
To be honest, it's just not as relevant. It doesn't seem to be as relevant. The entire latent concept of food safety, maybe it should be phrased differently, even though we changed the phrasing of the questions for data collection after the interviews. It's still not picking up, like affirmation is not moving in the way it could be expected.
So maybe I can go back and try to make it more easier, like why food hygiene or water is important for us in Bangladesh because of diarrhea. So we know that our village people are like, everyone know that if they drink contaminated water, they will get diarrhea, and if they like take unhygienic food, their kids will be in hospital. So that's why we understand, our rural people also understand these issues. For Mexico, I'm not sure about if diarrhea or like enteric disease is prevalent or not, like very prevalent. So and there is no connection with the food hygiene or the water contamination.
Not so much. I'm pulling toward the urban component, like the fact that there's infrastructure and that people are just used to storing food adequately, or adequately, so to speak, you know. It would definitely test different in a different setting, which is one of the takeaways we get from this. Like, this is only 2 sites, and we don't know how much of the findings is site specific or if it's actually what's happening, right?
And what level of staff you have recruited, like who are actually data collectors?
Who are the data collectors? It's part of the research center I work at. We have a data collection area. Like, they specialize in that. It was a team of 1, 2, 3, no, like 10 numerators, 3 supervisors. It was a large team. Yeah. Anything else? Yes.
Kind of in a similar vein, did you consider tailoring the questions to be more specific around food hygiene? So instead of asking in general food hygiene, maybe asking how often was a mosquito on your food, and kind of tailoring it that way?
We could do that. It's not like that right now. And again, in Spanish, we removed the entire concept of food hygiene. Food safety, it was removed. Like, we changed the wording totally because it's not used at all. Like, contrary to the actual word hygiene, higiene, like that's commonly used. Alimentos de forma segura is like, no one understood that. So we changed it more to the actual behavior. Did you use utensils that you felt were unhygienic? Like, we had to be more specific. And even then, it might be that people feel evaluated by this, and it requires refinement.
Yeah.
It definitely requires refinement because it's not a population that's used to being asked these questions.
Can I add something?
Yeah.
I think that's a great example of how maybe some of these items will need to be tweaked. And we did try to do that between rounds, based on the cognitive interview data at both sites, was to ask about those very specific instances. So like in the last week, how often did you have to eat a meal when your hands were not as clean as you wanted them to be, things like that.
Yeah, yeah. Okay.
Yeah.
And Josh is going to talk a little bit more about the data part he likes.
My other favorite part. Sweet. I'll just jump into it. So to kind of round us out and to see where we're at now, this is hot off the press data of like getting closer to maybe having some sort of suitable scale that's actually valid for this context. So as you'll recall, we had these 31 candidate items. After we piloted them, there were 7 that had low loading, so this is from some exploratory factor analyses, and that just suggests that they aren't loading onto a specific construct well. So they're up for dropping, but that's a very technical reason. And then there's separate items that are related to menstrual health and hygiene, and those are not inherently universal, so they are removed, but we are exploring them as a separate module that you could add on, so that you could have a core hygiene scale and then also a complementary one that is for menstrual hygiene. So I'll only show the core for now, but please do know that we're not just dropping that. It's a really relevant part of hygiene. So we ultimately had 20 items. These are kind of wonky diagrams that are like very specific for the like scale development world, but what it's essentially trying to communicate is that we found evidence of potentially not just one singular composite score, but the items were grouping and hanging together in this way of domestic cleanliness is what we're terming one of the factors. These were more of the questions that were around like cleaning of the household, having sufficient materials to clean the house. There were 4 items that were loading and performing well for food safety, with all the caveats. A bunch of items about personal cleanliness. This included hand washing, body washing, laundering, and also one of the questions about interpersonal relations. And then all of the items related to sanitation facilities loaded onto a separate construct. We're still like figuring out what's the best way. There's a bunch of potential structures we've tested for so far. This is one of the best fits. What these statistics are is just standard criteria for when you run a confirmatory factor analysis. You want certain thresholds, and they are looking quite nice in that they are either below, they're falling within what we would want. So low RMSEAs, high fit indices for these other ones, and low SRMR. You don't have to know all these, just knowing that they're falling into those thresholds is a sign that the scale is performing well and this conceptual model matches the data well. Okay, so well and good, cool, but like, does this predict anything? Does this mean anything? So I'm going to show you a few graphs. These are the tests of validity where we want to see if the measure is actually associated with things that we would anticipate it to be associated with. So the composite score, again, some debate, is that what we're going to use or not, TBD, but that's along the bottom. It ranges from 0 to 80. Higher scores mean more affirmation of the different experiences. And then this is the predicted probability of being water insecure. Okay, I'm gonna move away and actually show you what that data looks like. So pretty clear gradient. This is adjusting for site. These aren't supposed to be like tests of validity or just trying to see if there's an association. These aren't like trying to get at an association or causal mechanism, but we can build those types of models. But this is really heartening to see there's a really clear, great relationship between hygiene and water insecure as we would expect. This is now looking at the predicted probability of reporting diarrhea in the prior 2 weeks. This was also very strongly associated with greater hygiene scores. If you break it down by the subcomponents, in particular the factor about sanitation, and people who are reporting more issues with their sanitation facilities, much more likely to report diarrhea. Just to note, you also don't see the predicted probability going as high because the prevalence of diarrhea is not that high. And finally, really strong relationship with, there's a validated scale for perceived stress that can range from 0 to 40, and so looking at predicted scores, pretty clear gradient there also. So one of the main takeaways I would say from this is that in a context where 97% of people have a basic hygiene service, according to JMP, there's a lot of nuance that we would have missed. So there's a lot of people who are affirming and getting different scores across this gradient, and also that it's clearly related to outcomes of health interest. And when you run these models with the JMP indicator, you don't pick up anything because there's no variation. So this hopefully would actually be valuable in context. Sarah left.
Sarah left, but.
So before I jump to the next slide, I am happy to take additional questions, because then the next thing is an invitation. Yeah, so.
I was wondering what the range of the hygiene scores that you all saw. Like, did you have people in kind of the upper 60 to 80 range, or was it kind of skewed more towards?
Good question. A distribution plot would have been beautiful. Yeah, from what I remember when I ran these 2 days ago, was there is certainly a gradation, but I think it caps out around 60. There's not that many people who were affirming always to everything, which, as we would expect, would probably be few. But it was higher than I was expecting also, that there were people in the 40 to 60 range. That's very good question, yeah.
You had mentioned the diarrheal incidence in the past 2 weeks.
Yeah.
The question you're praying for 1 week, so I was curious about that effect.
Okay, I could also be misremembering
We
what we
had a
actually
1
asked.
week recall.
It's 1 week.
Okay, just kidding. It was a 1 week recall. No, that's a good
It's in
question.
the past week.
Yeah. Yeah, there's also questions that we have, like other health outcomes that we have yet to look at with this too. Like for households with children, we asked about them to report on diarrheal occurrence in a 1 week recall. I'm trying to think, there's a few other things that we're like really excited to start looking at this in relation to, including the sanitation quality of life that Ian Ross developed and colleagues, and
Respiratory health.
oh, and respiratory health. Like we asked some questions about like coughing.
We don't have
In Bangladesh,
And also, like I said, there's a subscale for menstrual hygiene that's coming out. But the long and the short of it is that we, oh yeah, please.
Yeah, I have a question. Did you do any questionnaires on how often they clean, how often they wash their hands, how often they do the laundry? Because I noticed one of the things they were concerned about was the floor. Is one of the physical items that I saw. And that came before anything I saw in laundry, hand hygiene, or anything. So is there more of a concern about hygiene related to the floor in a developing country than in, like, say, the U.S.? Because I know in the surveys we did, people say that in India they were wiping the floor every day, and in the U.S. it's once a week.
Yeah.
So I was kind of wondering, is there different objectives, or how often they actually do clean or wash their hands? Have you collected any data like that?
We haven't collected any behavioral data. That would be really interesting to look at that in relation to, are there certain behavioral practices that are associated with scoring higher on this? I mean, so to say, thank you, we should. And the way that this scale is constructed is the idea that we think the way it's going to manifest itself is that it's these certain experiences and not like actual behaviors of like how often did you do something, but that would be an interesting thing to compare that against. So thank you for the analytic idea.
So you haven't related security to how often they're cleaning anything then?
No, we have observational checks that we're going to be able to look at and say, based on the enumerator's assessment of the household, like those more classic observational checklists, is this a clean facility? Does the household look like it's mostly free of debris? I'm trying to remember some of the
It's
questions.
outside.
Okay,
Like,
yeah.
they only did it outside because they don't go in, but that's our proxy for that. It's an external evaluation.
And people provided some assessment of like what their household conditions were like, but again, I think that's a really big potential value add of this tool also, is that just it really struck me how much you were reporting that people really did not want you to go inside their homes. And like the classic spot check of, can you see if there's soap and water running, was not gonna happen.
Can I ask one more question? I'm curious just from like, I guess this is like a larger question of why you all decided on hygiene and security. I feel like you could name this like a lot of different things.
Yeah.
So I'd be curious, peek behind the curtain of kind of how you all decided on that specific name.
over lunch yesterday. I mean, it's always been hygiene as the topic, and it's a pretty broad thing. And then the idea of a framework, yeah, for insecurity. We were going back and forth, and we just added the term insecurity because it at least oriented around the other resource ones. But hygiene itself is not a resource. Like it is there's an enabling environment that allows you to practice certain hygienic behaviors. So. Yeah, the branding, still, we don't have like an official logo, and we're not sold on this name yet, but yeah, thank you. And if you have any ideas, please.
Follow-up question to Dr. Garba was asking about the floor cleaning and stuff.
Uh-huh.
Is there any question asked about how often, for example, they clean their bathroom, lavatory areas, kitchen, food preparation areas?
No.
They're not behavioral, like we were exactly not assessing their behaviors, but rather how they felt about their conditions.
So people would...
It would need to be an add-on.
So how they felt, do they feel okay? How their bathroom facilities
Uh-huh.
Yeah, or like an assessment of how clean the
the
facility
kitchen
is.
And their, the waste disposal areas and stuff like that.
Mm-hmm.
Mm-hmm.
If they're able to, if they feel they were able to dispose of garbage in the way they would have wanted to in the past week, and maybe they said always, or sometimes, or rarely, yeah.
And I think it would be really helpful to look at how the hygiene experiences compare to the frequency of cleaning. But what we're trying to capture is the experience of something that is negative or is far away from the ideal. And so even if someone's cleaning their home 5 or 6 times a day because they're living in Dhaka and dust keeps falling on the floor, that might not mean that their home feels clean to them. So we wanted to ask if the home felt clean to them rather than ask them how frequently they were cleaning it. But it would be really helpful to compare whether or not the behaviors match the experience.
Especially given since that's such a common way of assessing hygiene. But yeah, just to point out, yeah, like so instead of asking how often did you clean your hands, or how it was like, how often were you unable to get your hands as clean as you wanted? How often were you unable to get your body as clean as you wanted? So that was the phrasing, but it could be also then compared against like, it was meant to capture exactly what Liz is saying, like personal assessments of cleanliness, because we think that that's also associated with then subsequent health behaviors and actual, as we saw, it was associated with like stress. So you can wash your hands 4 times a day, but that might not meet your norm or your standard, and therefore you're going to feel more stressed, or you feel stressed about it because you actually know that you should have washed it a 5th time but you didn't have the ability to, and now it's leading to diarrheal disease or something. So I think combining those two would be really good though, because again, trying to show how these compare to other measures.
I think this is like really cool because it's like meeting the person where they're at and like their own perception, I guess, can we say, of cleanliness. But I'm just curious about the role of like wash education and how that influences it, because maybe you feel satisfied with your domestic cleanliness or how you dispose of things, and then there's an intervention of wash education, and now you have education that shapes you feel dissatisfied with those different things. So I'm just curious about like your recommendation for like implementers or practitioners in like who are trying to do wash education and also use this model.
I think that speaks to the value of a measure like this, because you would be able to see whether or not, or you would be able to see how a program is shaping a hygiene experience. So is it supportive and it's empowering, or is it potentially causing some harm that wouldn't otherwise be captured? So you could use this tool to look at those changes that would not otherwise be captured. Does that answer your question?
I think it's a really interesting question. I mean, people talk about this in the water security realm and food security realm too, of a lot of education-based interventions, and now that people are more aware, or they have a different threshold, does that change their insecurity? And I don't think it's a bad thing that can happen. I think that's like a reflection of that people are changing, and that's actually kind of capturing that process along behavior change of maybe they are feeling more worried, but it also captures what Liz is saying, of these sometimes unintended consequences of if this is so strongly associated with stress. That's not to say that they shouldn't receive this education or the things, but also to maybe that speaks to like creating just an enabling environment where you can pair the education with something else, so it's not just education for education's sake, but education plus soap or something. So it's like, okay, I feel like I need higher level of hygiene, but now I can at least also do something about it so I don't feel totally powerless.
Right, or tailoring programs so that they are more supportive to avoid increasing stress at the same time as providing education.
Happy to take more questions.
About the definition.
Yes.
Like when you say well-being, in how, whether it is included health.
Maybe please help.
Health.
We thought that well-being would capture health in terms of disease outcomes as well as psychological health in terms of stress and other psychological components that came up during the interviews.
Yeah.
But also very open feedback. These questions are excellent, so thank you.
And this will feed into the narrative review.
Definition of health already have in WHO. That include like mental and physical and well-being, everything is there. But that's why I'm just asking about well-being, how it is defined.
Yeah.
Whether it has a separate definement.
I think Liz said it perfectly. But yeah, like I said, dignity and well-being are doing a lot of work here, and in the paper we're trying to give you a one-sentence definition, but then it's like I think we need a little bit more of like, by dignity we mean that people are able to do it to the level that they like and prefer, and that well-being includes mental, physical health. So trying to be as comprehensive so that we capture all those 4 different frameworks that Danielle had talked about. I'm going to start zipping ahead so that I can, but I'm happy to take any other questions should they arise. Don't look, you'll get dizzy and sick. Okay. And then let's end on a high. Sarah had to take off. She, in classic fashion, messed up the flight times. This has happened many a time, so she's off. And she was going to be bidding you adieu and also inviting you to stay part of the network. So this is kind of reminiscent of like early days when we were trying to develop a cross-culturally comparable water insecurity scale. It takes a village, a community, and lots of good friends in many different places. So it's a big tent. I have felt like it's a real family and it's starting to grow, and we'd like you to be part of that. So the groundwork's been laid. We have tools available for piloting. So although we have the 20 items that we think work really well in Mexico City, they might not work well everywhere. So we would encourage you to go out and pilot, and if you want or want to pilot it, we have the resources and a guide coming out on how to do that. But like to go out and implement the full 31 so we can really see, is that 20 items that work well in Mexico also the 20 that work well in Kenya, that work well in Bangladesh, that work well in the United States. Protocol will be solidified soon. Please RSVP. Coming to just come join the family. You can talk to Sarah, Lucia. They know this very intimately. And just another acknowledgement slide for like this work represents many people, and very appreciative of all of their hard work and the funding that's made this possible. It's very cool that we've been able to get so much data collection on just one round of funding of Bangladesh, Mexico City, and doing 1,000 households, and also additionally retesting. So it's done all the way. And cognitive interest, yes. Oh, I forgot, we do have time. I was trying to run us right out till 3. I'm sorry, guys. Oh, there are questions if you want. I mean, nothing, that's fine, but you've already kind of helped raise some spots that we may have missed. So, like, we want to hear from you. What are we forgetting? What would it take to join the network? And, like, when this is done, how would you like to see it be used? So, I don't know if somebody else actually wants to. Yeah.
So how flexible the team is, if the tool is not working in the setting, in certain settings. Like our experience, like we have worked with a lot of collaborators in Bangladesh, and we found that some sections are actually not according to contextual settings. So then how this tool or how these things will actually adopt that changes.
Do you want to talk about how it wise? Just the
Oh, the like flexibility of the item? Yeah. There are ways to ask the questions that still get at the intended meaning, but can have flexibility so that it actually reflects the local context. So there's certain core meanings that we think that these items are trying to elicit or get at. So for instance, the food safety one about having utensils that are unclean. That one's maybe pretty straightforward, but we really want to know, do you think that the utensils you ate off of were unsafe or dirty? So you might need to tailor that, you might need to include a probe. So that suggestion of that I thought earlier of like asking about if a fly had landed on something, that's something that's like maybe a probe that would be a relevant way to help get people to think about it in a way that if they aren't connecting with those terms. I can say that like in Nepal, when we've asked people about worry, the word worry doesn't really resonate with people, so then we've said it's the emotion you might feel if, upset and anger. The feeling of upset or anger might be what you feel if your favorite soccer team loses a match. And people, that was like relevant and helpful for people to be like, oh, okay, I know what that feeling is. So yeah, happy to tailor and make it relevant to sites. And also, yeah, I wasn't sure if you were alluding to this, but yeah, it's also interesting if it doesn't work. Like we are not like looking to push like a scale that like it, promise we didn't cook those numbers. I was shocked at how well it worked actually, because we are asking so many different questions and like to have such like 4 very clear distinct constructs, but that may not be the case for all the sites, so we obviously want to see that.
And that's why more sites are needed. So if more sites are able to pilot these items, and then we can come together and say, yes, collectively these items are working, or no, collectively these aren't, we can come together and maybe do a revision of some of the items together.
Yeah.
You know, additionally, like Liz, you know, we work with Peter with about like coding of questionnaire. We tried to do this several times, but we failed because, you know, situation change and like hygiene practice change by communities and things. Although there are certain things that remain constant, but there are other behavior actually change with climate, with temperature, with socioeconomic status. Those are actually linked with this change. So that is the like sustainability of this type of system, how long we can use a certain amount, and when we'll finalize this, and after that how long this will actually continue. Those things needs to be actually also like think ahead of time that how much flexible we are in the future as well after 10 years to actually whether this tool will work or not. So that's a very open question. Yeah.
I wish somebody was taking a photo of this. Sarah would be so happy. If you want, in the manual that we have for the Y skills, there's a whole section on adapting and translating, and this kind of speaks to what you're talking about. So if you want to see how we've approached it in the past or how we could make it better, please feel free to pick up a copy and give feedback, because that's key to this working.
I have a question that maybe is a recommendation of maybe what you're forgetting. I might have missed this, but I'm wondering if you all thought about preference, because I feel like with hygiene, and especially thinking about dignity, preference is, I would say, really core to that, and being able to clean your body, clean your house, all the things, in preference in the materials, cleaning supplies, and especially with the menstrual health and hygiene stuff. I know you weren't able to present that today, but I think that's a thing that we miss a lot is, you know, we all have preferences. So I'd be curious to,
I think the best we got is like, things around like not worried, but
The wording in Spanish is kind of geared toward preferences, like as you would have liked, like the liking, the person liking is important.
That is interesting, because we asked about as clean as you would have liked. I'm trying to remember, and this may, I have to go back and look and see what, it could have been part of the original 49 items, but I'm trying to think, like if we ask questions of like, not only to the degree that you liked, but in the way that you liked. Like,
well,
did you
maybe
get to...
that question is getting at preference in some way, like maybe you don't feel like it is as clean as you would have liked because you're not using the thing you prefer.
It's
like,
worth-
we would have to go through the thought exercise of thinking
Yeah.
about that, but.
And like talk to, yeah, that's really good. Let's write that down. Yeah, I saw it, I saw it.
And people can say
What?
should we say, and people can stay.
Oh, yeah, I mean, yeah, it's 3 now, I think, so please feel free to take off. Thank you for being such an engaging audience, and again, if you want to get involved, feel free to come talk to us now, follow up later on with email. I'll flash back to these 2 lovely folks and just thank you again. Oh, wrong slide.
How are you?
I was able to book another flight.
Tonight?
Yeah.
Oh my
Still
God.
like basically the same time, it's just a very different path.
Nice work.
Thank you.
But challenging. Yeah.
Yes, very much so.
Also the hygiene changes, indicators I would say. When it will end, I'm not sure. What,
I'm at 3 years.
as much as we expand, different
The last few
geographical and
years,
different continent, it will give you more
It was very challenging in so many ways. Like just the Liz and I have been back and forth with language, culture, with setting, and also just, it's like abstract. Like hygiene is not an object.
So what is the ultimate goal?
To generate something like that, like yesterday was, when was it?
So I think that.
I was at a session using the conceptualization of hygiene, etc.
Because I have a feeling.
And there's a lack of empirical work on it. A lot of discussions are theoretical. So we're aiming to generate an empirical approach to start
But yeah, let's talk.
that goes beyond hand washing.
Yeah, I mean,
that goes
we're
beyond
trying to also
infrastructure
at the
because
outset,
the
the
concept
wide
is
scales
so
are
much
interesting
more
because
comprehensive. But it's really challenging. So to be honest, I don't know how to go about with what you mentioned, like there's really specific aspects called
Whoever gets to it first.
I have references for that. But as much as you would have wanted and I never
Stick together.
Yes, exactly.
So why didn't I
And the framing is like, we want to make it global,
Oh, okay, I got my,
but if you want
PhD at UNC, so.
geographically,
Or if you classes at UNC.
that may be like for Southeast Asia, for Middle East.
But we definitely need more sites in general, wherever it is.
Because you were just comparing the Mexico and Dhaka, like South Bangladesh, the rural area. And you can say it is very difficult actually.
That's why we didn't compare them for different reasons, but also within the city, we also see we leverage the fact that
Within
On that one, we
within the
same
city,
city.
we have
how does that
differences within
relate?
the
Are we
country.
capturing enough of it, or do?
Once we start moving around,
SCS